Welcome to this episode of The More You Know, a series of short videos produced by the Pennsylvania Link to Aging and Disabilities Resource Service Area 13 partners. Service Area 13 consists of Berks, Lancaster, and Lebanon counties, and it's one of 15 service areas across the Commonwealth of Pennsylvania that exist to provide long-term living information and resources for persons over 60, persons with a disability, veterans, family members, and caregivers. Hello, my name is Margie Degler Pizarro. I am your host for this series. I'm a geriatric and palliative care nurse practitioner who is passionate for abundant aging and living. The Pennsylvania Link to Aging and Disability Resources is part of a nationwide initiative developed to take a seamless approach in the way that we assist seniors and adults with disabilities who need help with activities of daily living. When you need long-term living information or assistance, call the PA Link to Aging and Disability Resource Center toll-free hotline at 1-800-753-8827. The title of today's episode is Getting to Know the Berks County Area Agency of Aging, and the name of my guest today is Jessica Jones, the director. And as always, the purpose for today's interview is to bring a renewed awareness of this Office of Aging and to discuss it in detail so that service providers, as well as those persons needing the services of this office, have reliable, up-to-date sources of information. So Jessica, thank you so much for being my guest today. Please take a moment to introduce yourself. And if I was to ask you to sum up the Berks Area Office of Aging and its services in a sentence or two, feel free to share that. Thank you for being with me today.
Sure. Thanks so much, Margie. It's great to see you again. And I appreciate the time to familiarize everyone with our office. I think the best way to summarize our office and an overview is to really just give you the mission of our area agency on aging. And that's to provide services based on need to all older Berks County residents and those with disabilities, empowering self-determination, advocating for their rights, and promoting the highest possible level of independence.
And that says it all, doesn't it?
It truly does.
That is a great mission statement. And so, as all area agencies of aging have, there are so many programs that Berks has to offer for the folks in that area. Would you be kind enough to share those different options?
Sure. We have a lot of different services that offer individuals at different points in older adulthood. So when you're looking at individuals that are maybe more in the independent living, more independent, or even individuals that are disabled that are more independent but need some assistance or want resources for information, our office provides we have a lot of different areas. Starting probably the best would be our senior centers. Berks County currently has 8 senior centers. We were, prior to COVID, providing 22 senior outreach locations. So we were actually going out on a almost daily basis, seeing individuals that were living in maybe some of the senior high-rise buildings within Berks County, providing meals and activities. But that's also what the senior centers are doing. Certainly through COVID, the senior centers have had to change some of their programming because right now we are still not back to full operation. So with 8 centers, 2 of our main centers remain closed. They are not open yet. That is our Boyertown area multi-service, and also the Hispanic Center, which is CASA. They are not open at this point, but they are providing what we're calling grab and go meals. So people can go in, grab a meal. The Berks Encore Centers, the 6 Berks Encore Centers, which are kind of sort of stuck throughout Berks County, Fleetwood, Douglasville, I'm going to forget certain areas, Reading, those centers are open. They have limited capacity. just based upon some of our regulations at this point. But they are providing some programming, and again, they also have the grab and go meal options. Also, we have a good, healthy health and wellness program options. We have the health and wellness basically promotes healthier lifestyles among older adults. Anyone can participate in those. We have the availability of some of those classes virtually. Those classes are managing chronic diseases and conditions, exercise, nutrition. They definitely are a variety of different programs to ensure that overall needs are being met. Also, for everyone relative to the Area Agency on Aging, we provide the APPRISE program, which is the Medicare Counseling services to older adults. And basically those APPRISE counselors are trained, and they answer questions and provide objective and easy to understand information about Medicare, Medicare supplemental insurance, and Medicaid and long-term care insurances. So those are kind of the more independent pieces. Some of the other pieces that we provide are things such as the home delivered meals for individuals 60 years of age and older that meet the criteria for needing home delivered meals. We provide that. Currently through COVID, we've expanded the program that we are providing 7 days a week. Normally it used to be 5. We continue to do that, and we're going to be doing that into the next, at least the next fiscal year. I foresee that continuing to manage. And also this year, well, and then let me talk a little bit about our options program. Our options program is essentially home and community-based services. It's considered more like a nursing home diversion program where individuals get in-home services to help them stay independent and stay out in the community risk-free. And it's really for assistance with bathing, dressing, grooming. We also have our caregiver support program, which is a twofold program where we will provide assistance and reimbursement of expenditures for caregivers. But then we also have the grandparents raising grandchildren program, which also falls under the umbrella of the caregiver support program. And that's a little different. You do get reimbursement on expenditures for grandchildren that they are raising and the expenses around that. And in addition to those types of services under caregiver support, you also get care management services. I don't know what else. Is there anything else you want me to touch on, Margie?
Well, what's happening right now with COVID? I know some of the limitations are being lifted that we were living under for the past year, but in terms of counselors going into the homes, seeing people, how is that working right now?
Well, so I think every county is a little different. For Berks County, what is happening currently right now is most of our staff are going out and doing face-to-face visitation. We've been, the only unit currently is the assessment unit, which conducts like level of care assessments on individuals and assesses their needs, and then works with them to apply with other types of programs. Those are primarily telephonic, but the other services, like I mentioned, through our options program, the caregiver support program, our protective services program, they're all doing face-to-face visitation.
That's terrific to hear. And of course, with each of the directors, I am spending a few minutes talking about the protection services, because a lot of older people have issues with different types of abuse and they don't know where to turn. They don't even know that the Office of Aging is one of those areas that they can turn to for support. Could you speak to that and what your particular agency does and has available?
Sure. So we currently we provide direct services through our office for protective services. We currently have 7 full-time workers who conduct investigations on abuse, neglect, exploitation, abandonment. There's certain criteria and risk areas that are identified that are indicated in our assessment process that help us to determine whether or not an individual is in need of protective services. Sometimes protective services has this scary sort of aura about it. Truthfully, what we do, we try to assist individuals through protective services when there are risks, only when there are risks identified, and that we can help with risk reduction, but we also try to make decisions and help the older adults make decisions that meet their needs best and try to ensure that we are utilizing their input in making those decisions and moving forward with the cases.
Absolutely. It's been my experience. Sometimes an individual can be in their right mind, but making poor choices. And that is not an area where you would step in because they're capable of making those decisions. But in an area where there's truly exploitation, abuse, what would an individual do to contact your service for assistance?
Sure. The one thing I always say to people, whether or not to call us, if you are not sure, call us. That's the bottom line. If you have suspicion and you're concerned for whatever reason, call us. It's not the individual's job or responsibility that's contacting our office to determine whether or not it's happening. The reporting sources, they are protected by the law. We cannot disclose that information as it relates to a reporting source. They can contact our office directly. We have 24-hour capabilities in answering calls and receiving reports. We have once we receive the information, we have mandated timeframes dependent upon what is being reported to us in order to respond. Obviously, like an emergency response would be just one of that, someone that is highly at risk and you can't ignore the situation and you have to respond very quickly. But that would be my biggest thing that I've always tried to say to individuals is, if you're concerned and if you're in doubt, call us. If it passes your mind that you think that maybe you might want to call, then give us a call. Sometimes, like Margie said, people make poor decisions and you have to allow individuals to do that. We can do that. People can do that at any age of their life, 18 and over. We always try to utilize some levels of self-determination when we're looking at cases and individuals' needs.
Absolutely. And so if somebody made a call like that, what would be the process? Would they get a call back to have someone come out and speak with them personally, or what would that look like for them?
Generally, our calls are answered live. So you would call into our main number. The main agency number is 610-478-6500. And when you call that number, you're going to get an intake individual that will receive the information and conduct the screening. One of the things we do not do, and sometimes this upsets individuals, but when you call with concerns, there's two things. One, we're not disclosing whether or not we're taking an actual report on the individual. We're hearing the concerns, we're doing our own internal screening and then making the determination on our response. And two, we have to ensure we will not follow up to the person that is calling us to say, hey, we saw your neighbor and these are the outcomes, because we have very strict confidentiality parameters that don't allow us to do that. And sometimes it's hard for family members or neighbors or friends to hear that, but that is some of the limitations around protective services.
Thank you so much. And of course, protective services is for anyone. The other services that AAA provides that are relegated to income, what would the process look like if someone was looking at, maybe an options program? What types of information would be gathered for that individual?
Sure. So the options program being the case management and option services where you're getting in-home services coming into the home. Like I said earlier, the personal care, bathing, dressing, grooming, assistance. Those, yes, there are some income limits and parameters around them, but generally the care plans do have an established cap on each one of them. However, you have actually a percentage copay that goes along based upon your income, the individual's income. And really, it's the role of the case manager once the case is opened in order to really assist that individual. It's really just simply verifying what your monthly income is and then making the determination from there. It's kind of in a nutshell, but making the determination from there then as far as what their percentage is.
And again, if anyone has a need, they shouldn't hesitate to call because, again, your coordinators will determine their eligibility.
Correct. And when you make that initial call, one of the first things that will happen is likely you can make the referral, but then what will happen from there is the individual will be assessed for their need. And then once that assessment happens, we'll decide, is it going to go to the options casework, an options caseworker, or are we going to refer to the independent enrollment broker for Pennsylvania to begin an application process for home and community-based services?
Sure.
That's a very broad statement, but those programs, all the programs have a lot of small little nuances. That's our jobs to really, once we get out there, is to really explain to the individuals, this is where we think you need to go. This is where it's going to best suit you in the long run.
Terrific. And so as individuals or their family members are hearing this, tell us again the best way to contact Office of Aging to get the ball rolling for what they may need.
Sure. So we have our main number, which is the county phone number here, that you would get a live individual answering in that 610-478-6500. Also, we do have a website. I would suggest the individual, instead of giving you because it's off the county website, the easiest way is if you Google Berks County Aging, we actually come up as the main homepage and you can look there. And then we also have an email that individuals can email at any time of day if they want services, if they have questions, and then we can have an intake worker respond to them. And that's aging@countyofberks.com.
Excellent. Jessica, thank you so much for this excellent presentation today and for sharing the more you know about Berks County Area Agency of Aging by the Pennsylvania Link to Aging and Disabilities Resource Service Area 13 Partners Network. My name is Margie Degler Pizarro, and I thank you for joining us today. Be well, and remember, when you need long-term information or assistance, call the PA Link to Aging and Disability Resource Center toll-free hotline at 1-800-753-8827. And I'm going to put that screen up now so that you can see it one more time. I thank you for joining us today and be well. Thank you, Jessica.
Thank you.
Bye-bye.